And if you or anyone you love has ever needed emergency or specialist care in southwestern Ontario, you need to really hear this, because this is one of the largest acute care teaching hospitals in the entire country. It serves London and all of southwestern Ontario. They just announced that they're cutting up to 288 registered nurse positions. That is over 560,000 hours of specialized nursing care being wiped completely out. We're talking about pediatrics. We're talking about inpatient care, ambulatory services. These are some of the most crucial units within the hospital. And now here's the other piece that I find quite concerning. The hospital isn't just cutting nurses, they're actually replacing some of them with registered practical nurses or RPNs. And look, RPNs are incredibly valuable within the healthcare system. They are still nurses. Registered nurses are trained to handle complex, unpredictable, high acuity patients, the ones that have the most serious conditions. RPNs are trained for patients with more stable, predictable needs. However, the landscape is shifting a little bit to seeing more RPNs dealing with more complex patients, which is fine. My concern here isn't the swap, it's the reasoning behind the swap. If you're cutting positions to save money, that's problematic for me. And if we boil this down to its nuts and bolts, it works out to being about $20,000 per position per year. Budget decision, it can also be a patient safety decision. And we know this is happening because hospitals all across the GTA are drowning in millions and millions of operation debt. There are some hospitals that have even taken out lines of credit to continue to pay for operating services. The hospital says that its clinical staffing grew by 23% since 2019, but patient volumes only grew by about 4 to 11% depending on the unit. So they're saying that they're overstaffed relative to Ontario hospitals. But here's where it gets really hard to swallow. The Ontario government just approved a 4% funding increase for hospitals as part of the provincial budget. And the Ontario Nurses Association says LHS has the money, but they choose to cut anyways. That's just scandalous. And let's not ignore the context here. In 2025, the LHSC's CEO was fired after an alleged embezzlement scheme involving senior hospital leadership. Public money, your tax dollars, allegedly was misused at the top of the food chain. So who is being prioritized? Patients or budgets? But cutting hundreds of nursing positions at one of the country's largest teaching hospitals doesn't just hurt London, it sets a precedent, a dangerous one. If they can do it, other hospitals across Ontario and Canada will feel empowered to do the same. This is a domino effect that's just waiting to happen, and we have seen this in the past.